Ready to talk about akathisia? Confused about this sneaky side effect and how you may notice it in therapy? Hi, it's Brain Bites with me, Dr. B. I'm Jess Beachkofsky, your friendly online psychiatrist. Let's dig in. Meet Sarah. She's a 28-year-old teacher who started an antipsychotic, Abilify or aripiprazole, to help stabilize her bipolar disorder. A week later, she comes to therapy fidgeting, constantly shifting in her chair. And she tells you, I feel so agitated and restless. I can't stop moving, but I don't even know why. Is the medication making me worse? This is classic akathisia, but it's easy to mistake for anxiety or worsening symptoms. Today, we're going to explore what's happening in Sarah's brain and body, how you can recognize akathisia, and what you can do to help clients like her. So, what is akathisia? Akathisia is a movement disorder often caused by mental health medications. It's not just physical restlessness, although that's a big part of it. It's an overwhelming inner agitation that clients might describe as feeling like they're crawling out of their skin. Symptoms can include constant pacing, fidgeting, or leg shaking, or emotional agitation like irritability, anxiety, or even despair. Importantly, akathisia can look like anxiety, but it's not the same thing. We'll dig into that more in just a bit. So, what's happening in the brain and body? Let's talk mechanisms. What's actually causing these symptoms? First off, there's dopamine dysregulation. Many medications that cause akathisia, like antipsychotics, block dopamine receptors in the brain. Dopamine plays a key role in motor control and reward pathways, so blocking it can lead to restlessness and discomfort. Then there's serotonin involvement. SSRIs, which increase serotonin levels, can also indirectly affect dopamine pathways, potentially contributing to akathisia. And then, of course, there are always other factors, like imbalances in norepinephrine and GABA, which is the brain's calming neurotransmitter, that also play a role, especially in people who experience anxiety-like symptoms. Physiologically, the motor symptoms are thought to arise from disruptions in the basal ganglia, a part of the brain involved in movement regulation. The emotional agitation likely stems from these pathways interfering with reward and motivation systems. And the result is that people feel awful. So, how can we differentiate akathisia from anxiety and other causes? Akathisia often gets misdiagnosed as anxiety or even worsening psychosis. So, how can you tell the difference? Here are some key features of akathisia. The restlessness is not relentless, not tied to specific worries or triggers, and it's primarily physical with a strong inner urge to move. But what else could it be? It could be generalized anxiety disorder. Look for the cognitive symptoms like excessive worry that aren't typically part of akathisia. Maybe it's panic attacks, but these are usually sudden and episodic, unlike the constant restlessness of akathisia. Is it tardive dyskinesia? These involuntary movements, especially facial grimacing, are distinct from the purposeful movements seen in akathisia, where people definitely know they're moving. And there are some rare causes of akathisia too, like hyperthyroidism, withdrawal from benzos, or neurological conditions like Parkinson's disease. So back to our case. Sarah's description of physical agitation paired with her recent start of an antipsychotic points strongly to akathisia. She doesn't report excessive worry or the cognitive distress that's typical with anxiety. As her therapist, you're in a great position to help her figure this out. So, how can you help? First, you can normalize the experience. Let clients like Sarah know they're not going crazy. Explain this is a physical side effect of your medication, not a sign that your mental health is getting worse. Start by asking the right questions. Some good examples are, have you noticed feeling restless since starting this medication? Or, do you feel like you need to move constantly even when you're not anxious? Then support self-advocacy. Encourage your clients to discuss these symptoms with their prescriber. A psychiatrist might lower the dose or even switch to a different medication. Other times, they may add a beta blocker like propranolol, a benzodiazepine, or a specific medication called cogentin or benztropine to help relieve the akathisia. For immediate coping strategies, you might suggest grounding techniques to help manage emotional distress, like deep breathing or mindfulness. And encouraging some light physical activity could also help if moving provides temporary relief. Akathisia can be really distressing and uncomfortable for clients, but therapists play a key role in identifying it early, validating the experience, and guiding clients towards effective solutions. For Sarah, understanding what's happening and collaborating with her prescriber will make a huge difference. I hope your brain is full of identifying sneaky side effects. No restlessness required. Be sure to grab more tasty tidbits at brainbiteswithdrb.com. Enjoy!